Hello everyone, I am Dr. Rahul Dubbaka, consultant gastroenterologist and hepatologist, Care Hospitals. Today we will be talking about jaundice, which is caused by viruses. Though there are many causes of jaundice, the jaundice which is caused by virus is one of the most common thing which we see in our gastro and liver OPD. So in our country there are four common causes of jaundice caused by viruses. One is hepatitis A, one is hepatitis E, and the other are hepatitis B and hepatitis C. Out of this, hepatitis A and hepatitis C are transmitted to the body via food or water, and whereas hepatitis B and hepatitis C are transmitted through blood related products, and through sexual intercourse, and also from a mother to child, and also by sharing of needles. Okay, so today we will be first talking about viral jaundice. So in this, the hepatitis A and hepatitis C are also called as self-limited jaundice, because sometimes without any medication also, after a certain period of time, likely about 2 weeks or so, the virus is eliminated from the body and the jaundice is decreased. In this phase, what we need to do is we have to take adequate rest and take good diet and fluids, and the jaundice will slowly subside by itself. But if a patient has jaundice, he has to first get himself evaluated to see the cause of jaundice. That is, what is the cause for the jaundice. In hepatitis B and hepatitis C, in acute phase, the patient presents with jaundice and also loss of appetite and also sometimes pain in the abdomen. So once the patient is diagnosed with hepatitis B or hepatitis C, then specific antiviral drugs are available which can be started to the patients, which will give them benefit from the jaundice, and also it will also prevent the further progression of the jaundice. So in hepatitis B, one good thing is because it has a vaccine, it can be easily preventable. So previously the vaccine was not routinely given to every newborn child, but since the last 15 odd years, every newborn child is vaccinated. And also if there is any patient with hepatitis B, all their family members should also get themselves checked for hepatitis B. And if there is anyone who is not vaccinated yet, then they have to take the 3 courses of vaccine, so that they can be prevented. The hepatitis B transmission can be prevented. Hepatitis C per se does not have a vaccine yet, but it has very good antiviral medications. And depending upon the type of hepatitis C virus, that is the genotype, the treatment depends. Either some people will require a 12-week course, some people will require a 24-week course of treatment. In hepatitis A and E, because mostly they are self-limited, but if the patient has progressive jaundice, then they will also be started on antivirals sometimes. But very rarely do this jaundice progress into a fatal disease. But if hepatitis B and hepatitis C are not treated adequately, there is a chance of going into chronic liver disease and later into cirrhosis of the liver. And also sometimes it can lead you to hepatic malignancy, that is also called as liver cancer. So if a patient is having chronic hepatitis B or chronic hepatitis C, every 6 months they have to undergo an ultrasound checkup to see if there is any alteration of the liver size, or if there is any mass which is starting in the liver. Because what this does is, if the patient is detected at an early stage and if there is a small lesion in the liver, then it can be surgically removed and also the patient can be cured of the disease. But if the lesion is detected at a later stage, then surgery may not be an option for the patient, and chemotherapy may be an option for those kind of patients. Thank you.